and welcome back to the second video in my Movember health tips series, where I'll be talking over various topics to address our disparity in men's health. Today we're going to do a brief overview of what I consider the canary in the coal mine that foretells poor future health outcomes. Maybe you've never heard of this condition that affects tens of millions of people in the US alone. This condition is called Metabolic Syndrome, also known as Syndrome X. Metabolic syndrome isn't a disease in itself, but is actually a group of risk factors that when combined have shown an increased risk of cardiovascular disease, which can lead to heart attack and stroke. It's shown to increase the risk of developing type 2 diabetes and has even been shown to be linked to dementia and various cancers. I've seen statistics that show up to 34% of US adults having metabolic syndrome. That is over 1/3 of US adults. Just think about it. 1 in every 3 adults you see in the US could possibly have a medical condition that is shortening their lifespan. This is not good. The factors that contribute to metabolic syndrome include elevated blood pressures, elevated fasting blood glucose levels, an expanded waistline circumference, fasting lipids showing low HDL values, and elevated triglyceride values. And please keep in mind that if your numbers are controlled on medication, then you are not off the hook. That still counts as a check in the respective category. If you have 3 or more of the previously discussed risk factors, then you have metabolic syndrome. These risk factors can easily go unnoticed. In my practice, I feel like on most days, I'm discovering patients with newly diagnosed elevated fasting blood glucose levels, or elevated blood pressure readings, or abnormal lab values when it comes to their fasting lipid panels. All of these people had no idea their metabolic machinery has been compromised. The part that's so deceiving about these conditions is that it doesn't hit you like an alarm sounding loudly. There's no pain, and you can't necessarily feel that something is wrong. I can't tell you how many times I have informed someone of a new diagnosis and they reply, "But I feel fine." It's more accurate to think of these like a check engine light in your car. You're on the road of life, and then that very dim and small signal pings on. But you feel like your car is driving fine. There's no smoke, no weird noises, or shaking, so you put off getting it checked. That procrastination can go on indefinitely until eventually the car breaks down and you find yourself stranded, wondering how you got so far off track. I urge all of you out there to get regular checkups with your primary care provider. Knowing that you're at risk is the first step to start making some major lifestyle changes. Do not wait for the car to break down. Car parts can easily be replaced, but this is far from the case when it comes to the human body. So folks, the rabbit hole goes really deep here. So I'll dedicate future videos to discuss some of the individual risk factors further. In those videos, I'll touch more on causes and strategies to treat these conditions. If you know anyone who might benefit from listening to these videos, and I'm speaking men or women because this condition is affecting all of us, then please share. And again, thank you for your time and support.